All right, today we are diving deep into one of the most incredible pieces of engineering in the entire universe, the human heart. Now, we usually talk about it in poems and songs, right? But for this explainer, we're going to look at it for what it really is, a powerful, relentless, and unbelievably sophisticated machine. It's your body's ultimate engine.
And just to give you a sense of the sheer scale we're dealing with, think about this. Every single month, this organ, which is small enough to fit in the palm of your hand, pumps enough blood to fill a small swimming pool. How on earth does a biological machine pull off a feat like that? Well, let's pop the hood and break down the mechanics.
Okay, first let's zoom out to the big picture. The heart isn't working solo. It's the command center of the cardiovascular system, which is basically your body's massive transportation network. You can think of it like a nationwide delivery service, with blood vessels acting as highways, delivering all the good stuff like oxygen and nutrients and hauling away all the waste products.
So let's get back to that central engine and just how ridiculously powerful it is.
The amount of work this thing does is just staggering. Get this, 7,000 liters every single day. To put that into perspective for you, that's more than 35 bathtubs full of blood. And it does this continuously, without a single break, for your entire life. This isn't just a pump, it's a high-performance biological workhorse.
So for any critical piece of machinery, there are two things you've got to know right away. Where is it located and how is it protected? The heart is nestled right in the middle of your chest, in a little compartment called the mediastinum. But here's a fun fact, it's not perfectly centered. About 2/3 of it is actually tilted over to the left, and that's why you feel your heartbeat more strongly on your left side. It sits securely on your diaphragm, with your breastbone and ribs acting as a natural protective cage.
And check out this brilliant protective casing it has, the pericardium. Now, this is not just some simple bag. The outer layer is tough, kind of like a rigid housing that stops the heart from overstretching and keeps it locked firmly in place. Then, the internal layer is this clever, double-walled sac with a lubricating fluid inside, which allows the heart to beat millions and millions of times without any friction at all.
All right, so we've seen the housing. Now let's get into the engine block itself, the 4 chambers where all the real action happens.
The heart is split into 4 distinct chambers, and each one has a very specific job. The easiest way to think about it is as a 2-stage pump. The right side, the atrium and the ventricle over there, they handle all the deoxygenated or used-up blood. Meanwhile, the left side, with its own atrium and ventricle, handles all the fresh, oxygen-rich blood that's ready to be shipped out. Now here's where it gets really cool. Just compare the 2 main pumping chambers, the ventricles. Look at the difference in wall thickness. The right ventricle only needs to pump blood next door to the lungs, so its wall is thinner. But the left ventricle? Whoa! It has to pump blood to your entire body, from your brain all the way down to your toes. It is an absolute powerhouse, and its thick, muscular wall is built for that incredibly demanding job. Let's zoom in on the right atrium for a second. You can think of this as the main receiving bay for all the used blood coming back from the body. It has this fascinating internal structure with a rough, muscular front wall and a smooth back wall. And that smooth wall is where 3 major veins all connect and empty out. The superior and inferior vena cava, bringing blood from the top and bottom of your body, and the coronary sinus, which drains blood from the heart muscle itself.
An engine this powerful needs more than just chambers, right? It needs some sophisticated plumbing and really precise valves to control that intense flow of blood and make absolutely sure everything moves in the right direction.
And these are the heart's 4 valves. Their purpose is simple, but it's absolutely crucial. They act like perfect one-way doors. They open up to let blood pass through, and then they snap shut to prevent any of it from flowing backward. This one-way traffic system is absolutely essential for the whole thing to work. So let's actually trace the full journey. Deoxygenated blood, that spent fuel, flows into the right atrium and is sent to the right ventricle. From there, it's pumped to the lungs for a pit stop. In the lungs, it drops off all the CO2 exhaust and picks up fresh oxygen. Now, this high-octane oxygenated blood zips back to the left atrium, gets loaded into the powerhouse left ventricle, and then, boom, it's blasted out to the entire body. And this entire refueling cycle, it happens with every single beat of your heart.
Okay, so we've got the engine block, we've got the plumbing, and we've got the fluid. But even the best engine in the world still needs 2 more things to run: a dedicated fuel supply and a control system. Now this is such a wild concept. The heart is literally full of blood, but it can't use that blood for its own energy. It needs its own dedicated fuel lines, and those are the coronary arteries. These little arteries branch right off the aorta and wrap around the heart muscle itself, delivering all the oxygen-rich blood that the heart needs to keep on pumping.
And this is where all this anatomy becomes critically important in the real world. This quote is from a 57-year-old man who showed up at the emergency room, and his symptoms are a textbook and terrifying description of a major cardiac event.
The diagnosis was clear, and it was immediate: a myocardial infarction. In other words, a heart attack.
And what was the cause? It was a blockage in one of those vital fuel lines we just talked about. Specifically, a major one called the left anterior descending artery, or the LAD. When that fuel line gets blocked, the heart muscle it supplies gets starved of oxygen and begins to die. This really shows you these coronary arteries are, quite literally, a matter of life and death.
So what about the control system? Well, the heart's rate is controlled by the autonomic nervous system. You've got sympathetic nerves, which are like the accelerator, speeding it up when you exercise or get scared, and then you have the parasympathetic nerves, especially the vagus nerve, which act like the brakes, slowing it down when you rest.
But here's the most incredible part. As this quote says, if you could somehow cut every single nerve going to the heart, it would just keep on beating. How? Because the heart has its own internal pacemaker, the sinoatrial node. It generates its own electrical impulses, which gives the heart this amazing ability to run all on its own.
So we've seen this unbelievably intricate, powerful, self-regulating machine. It truly is a masterpiece of biological design built to run for decades. But as that case study showed us, it's also a system where the failure of one tiny part, like a single blocked artery, can have catastrophic consequences. It really leaves us with a final question to think about. With a machine this complex, how do we keep it running for a lifetime?